This is video 1 of the thorax series. In this video, I will be talking about the osteology of the thorax, and in the second part of this video, I will be talking about the intercostal muscles, nerves and vessels. Thoracic cage is formed by a number of bones joining together. They protect the heart and lungs and blood vessels. Anteriorly, this flat bone is called as a sternum. On the sides, there are 12 pairs of ribs with their costal cartilages. On the posterior aspect, it is completed by 12 thoracic vertebrae which join with the posterior aspect of these ribs. The two other bones which lie over the thoracic cage joining the upper limb with the axial skeleton is the left and the right scapula, and anteriorly the right and the left clavicle. Thoracic inlet is formed anteriorly by the superior border of the sternum. The first rib and their costal cartilages, and on posterior aspect is completed by the superior border of the first thoracic vertebrae. The plane of the thoracic inlet is on an incline. The posterior end lies superiorly. The inlets gives passage to many big vessels which are going to supply the head and neck and the upper limb area, and they pass from the thoracic cavity into the neck through the inlet. There is a visceral column which is coming down from the head and neck area, which is the trachea and the esophagus. They enter the thoracic cavity through it. Another very important structure which lies on either side of this inlet is the apex of the right and left lung. It's an important clinical point because an injury into the neck area can injure the lungs. Another important clinical point is a condition called as thoracic outlet syndrome. In 1% of population, there can be an extra rib. This rib attaches to the 7th cervical vertebra, and it can cause pressure over the spinal nerves C8, T1 when they are coming out of the thoracic inlet to leave for the upper limb. Sternum is the flat bone which lies on the anterior part of the thoracic cage. It is formed by the 3 distinct parts: the manubrium, the body and the xiphoid process. Manubrium is the superior part of the sternum. Superior border is called as suprasternal notch. On the sides, it has got articular facets for clavicle to join to make the sternoclavicular joint. Below that or inferior to that is the first costal cartilage comes and joins with the manubrium, and half facets for the second rib or second costal cartilage to come and join. Manubrium joins with the body, and they usually in the adult stages there is a ridge which is called as sternal angle or angle of Lewis. This is a very important clinical landmark. The rib counting can be done from this point because the second rib comes and attaches at this angle. There are other important things which are happening inside the thoracic cavity. Example is the trachea at this point divides into two primary bronchi. The ascending part of aorta becomes the arch and the arch becomes the descending aorta at this point. The sternal angle lies at the junction of T4, T5 vertebrae. So, if we rotate it on this side, here is 1, 2, 3, 4, 5 and that is the junction of T4 and T5, and this is where anteriorly the sternal angle lies. Body of the sternum extends from the sternal angle to the xiphoid process. On either side, it has got articular facets for the costal cartilages of the second, third, fourth, fifth, sixth and seventh rib. Xiphoid process is a pointed projection on the inferior aspect of the sternum. It is usually cartilaginous and get ossified in the adult life. The outlet of the thorax is a very big aperture. It is formed by the inferior border of the 7th, 8th, 9th, 10th and costal cartilages, and on the posterior aspect the 11th rib, the 12th rib and the body of the 12th thoracic vertebrae. This aperture is closed by a muscle which is called as diaphragm. On this model, we will see the attachment of the diaphragm. It attaches on its circumference of all the costal cartilages, and on the posterior aspect it attaches to the fascia of the posterior abdominal muscles, and it attaches to the first to third lumbar vertebrae. There are three major openings. At T8 level, the inferior vena cava enters the thoracic cavity. At T10 level, the esophagus enters the abdominal cavity along with the anterior and posterior vagal trunk, and at T12 level, the aorta enters the abdominal cavity. On this X-ray, we can see the left and the right dome of the diaphragm. The right dome of the diaphragm lies higher than the left dome of the diaphragm because of the presence of the liver on the right hand side in the abdominal cavity. The center area is called the central tendon, and that is where the heart sits over the diaphragm. Let us look at the ribs of this thoracic cage. There are 12 pairs of ribs on either side with their costal cartilages. First rib attaches to the manubrium. The second rib attaches to the manubrio-sternal junction, which is angle of Lewis. Third to seventh attaches directly to the body of the sternum. 8th, 9th and 10th ribs attach to the costal cartilages above it. 11th and the 12th rib are called as floating ribs because they have no anterior attachment. The pointed ends of the 11th and the 12th can be felt on the posterior abdominal musculature. The 12 pairs of ribs are also classified as typical and atypical ribs. Rib 2 to 9 are the typical ribs. 1, 10, 11 and 12 are atypical ribs. On the posterior aspect of the rib, this expanded area is called as the head of the rib, and it has two articular surface to join with the demifacets on the side of the corresponding vertebrae. This constricted area is called as the neck. Where the neck meets the shaft, this projection is called as tubercle of the rib. It has two parts, a non-articular surface and an articular surface. The articular surface joins with the transverse process of the corresponding vertebra. This area here where the rib changes its direction to forward and inferiorly, this is called as the angle of the shaft, the weakest point of the rib. On the internal aspect of the rib, in its inferior border, this groove is called as costal groove. The costal groove travels from posterior aspect to the anterior aspect, lodging the neurovascular bundle, and it protects the intercostal bundle along its way to the anterior aspect of the chest wall. This is the first rib. We are looking at the posterior aspect, and this is the anterior aspect of the first rib. Internal border, the outer border, it has a superior surface and an inferior surface. It sits like a collar at the base of the neck. The rib attaches by the head to only one thoracic vertebra, the body of the first thoracic vertebra. There on the superior surface, marked by this black dot, there is a tubercle, a slight bump, which is called as scalene tubercle. Anterior to that, there is a groove, and there is a groove posterior to it. Subclavian vein lies into the anterior groove, and the subclavian artery lies on the posterior groove. Let me describe some of the features of a thoracic vertebra. The body is medium size, heart shape. It has demifacets, which is one on the superior aspect, one on the inferior aspect, for the articulation for the head of the rib. These two round structure or pillars are called as pedicles. So, there is a right pedicle and the left pedicle. These flat bone on each side is called as lamina. Again, there is a right and the left side. Where the pedicle meets the lamina, this projection on each side is called as transverse process on either side. Where the two lamina meets, this projection is called as spinous process. Tip of the spinous process can be easily palpated onto the surface. This area just inferior to the pedicle is called as intervertebral notch, and it is completes and becomes a foramen when the adjacent vertebra comes and joins with this one. Through this opening, the spinal nerves exit the vertebral canal. This round opening, which is created by the two pillars and the lamina, is called as vertebral canal, and it lodges the spinal cord. These area here are called as superior articular facets, and these area here are known as inferior articular facets. On this vertebral chain, let's see the superior articular facet, how they join the inferior articular facets. So, the vertebra above comes down to join with the superior articular facets. Intercostal nerves are the ventral rami of the T1 to T12 spinal nerves. They exit from the intervertebral foramina and they carry the sensory fibers, motor fiber and sympathetic motor. The sensory fibers supply the anterior chest wall and the abdominal wall. The motor fibers, they are going to supply the intercostal muscles and the abdominal muscles. The sympathetic motor are going to supply the smooth muscle of the blood vessels as well as some of the sweat glands. To understand where they are coming, I have to talk about the spinal nerve. So, let me introduce you to spinal nerves. On this model here, we are going to show you all the spinal nerves which are coming out from the spinal cord. This is medulla, and down here in the central canal we can see the spinal cord. There are 31 pair of spinal nerves are given on each side. They are named corresponding to the vertebra where they are coming from. There are 8 cervical, 12 thoracic, 5 lumbar and 5 sacral and 1 coccygeal. The spinal nerves in the cervical region from 1 to 7 come out above the corresponding vertebra. So, in this model here, this is the first one and this is the first cervical nerve. This is the second cervical nerve above the second cervical vertebra. C8 spinal nerve comes between the C7 and T1 vertebrae. Rest onwards, all the spinal nerves come below their corresponding vertebra. So, the breast is a modified sweat gland and it lies in the superficial fascia of the pectoral region. It lies between the skin and the pec major muscle over the second to the 6th intercostal space. It gets the blood supply from the internal thoracic artery. The skin over the breast area is supplied by the intercostal nerves coming from the 2nd to the 5th intercostal nerves. The lymphatic drainage of the breast is rather important when we are looking at the breast cancer. 75% of this lymphatic of the breast drains into the axillary lymph nodes. So, let me demonstrate some of the intercostal muscles. There are 3 intercostal muscles: external, internal and innermost. First, we are looking at the anterior chest wall. The first 2 muscles are the muscles of the upper limb, pectoralis major and pectoralis minor. When we remove that, we can have a better view of the intercostal space lying between the 2 ribs. There are 11 pairs of intercostal spaces on each side. They are filled by three muscles: external intercostal, internal intercostal, and innermost, which we cannot see. External intercostal muscle, my probe is lying underneath that, goes downwards, forwards. The direction can be described as hands in the pants pocket. Internal intercostal are opposite to the external intercostal. The direction of the fibers is medially and upwards. Now we are looking the internal surface of the chest plate. There is the sternum. On each side of the sternum, we are looking at these structures running from the superior to the inferior part of the chest wall. That is your internal thoracic artery. Internal thoracic artery gives the 7 branches. These are called as anterior intercostal arteries. So here we can see one of the anterior branch. In the 7th intercostal space here, it divides into 2 terminal branches, the musculophrenic artery and superior epigastric. Musculophrenic, this branch supplies the diaphragm, and superior epigastric supplies the anterior abdominal wall. In the intercostal space here, we also see the innermost, the deepest layer, and that is your innermost lies in the same direction as the internal. Between the innermost and the internal lies the neurovascular bundle. So, on this prosection I will show you the course of the intercostal nerve. For orientation, this is the superior end of the body, inferior end of the body. This area here is the right dome of the diaphragm, anterior chest wall and the posterior chest wall. Now I am holding the neurovascular bundle. The neurovascular bundle travels in the costal groove, and the position of these bundle is from superior to inferior is called vein, the intercostal vein, posterior intercostal artery, and the intercostal nerve. We also see white rami communicant joining the sympathetic chain. The intercostal nerve supplies the intercostal muscles. It gives a lateral cutaneous branch to supply the skin on the lateral side of the body, and anterior cutaneous branch on the side of the sternum to supply the skin of the anterior chest wall.
Wade in the water, wade in the water, children, wade in the water, and God's gonna trouble the water. Who's that standing dressed in red? Wade in the water, must be the children that Moses led, and God's gonna trouble the water. Wade in the water.